Hello everyone, my name is Vaishnavi Mahadev Wallekar. Today is a technical topic. So we are discussing on to the cardiovascular systems. The cardiovascular system is also known as a circulatory system. The cardiovascular systems consist of three main components like heart, bloods and the blood vessels. The cardiovascular systems is responsible for transporting the bloods, nutrients, gases throughout the body. It is also responsible for removing the waste out of the body. Then the main functions of the cardiovascular systems is the transportations, protections, like transport the nutrients, gases, etc., or the hormones throughout the body, or to protect the body against the infections. Then maintains the pH balance, maintain hemostasis, maintains the body temperatures. Then the three components of the cardiovascular systems: heart, blood vessels and the bloods. The heart is a motor pump of the body. Then heart is a motor pump of the body. Heart transport or carries the blood or provides the blood throughout the body. The heart is located into the thoracic cavity. There are four layers of the heart: epicardium, myocardium, endocardium. Then there are four chambers of the heart: left atrium, right atriums, left ventricles, and the right ventricles. The left atriums and the left ventricles are the upper chambers of the heart. Then the left atrium and the right atriums are the upper chambers of the heart. They having the thin walls as they receives the bloods. Then the right atri- then the right then the right ventricles and the left ventricles, they are the lower chambers of the heart. They having the thick walls because they pumps the blood throughout the body. They pumps the blood throughout the body. Then the right atrium receives the deoxygenated bloods from the body via the superior and the inferior vena cava. Then the right ventricles receive the deoxygenated bloods from the lungs. Then the left atriums, they carries the oxygenated bloods from the lungs. And the right ventricles, they carry the oxygenated bloods throughout the body. Then carries oxygenated blood throughout the body. Then the electric conduction system of the heart, it contains the SA node, AV node, then the bundle of His and the Purkinje fibers. Then the valves are responsible for the unidirectional flow of the blood. They ensures the flow of the bloods. Then there are two types of the valves, like cyanoatrial valves and cyanoatrial valves. It consists the tricuspid and the bicuspid valves. Then the semilunar valves. Then semi-lunar valves. Then the blood vessels. The outer covering of the blood vessels are from the smooth muscles. The three types of the blood vessels: arteries, capillaries, and the veins. First one, it is the arteries. Arteries carries the bloods away from the hearts. Exceptional is pulmonary artery. Arteries having the thick walls and the elastic in the natures. Examples: aorta arteries or the carotid artery. Then the veins carries the bloods back to the hearts. They having the thick walls. Exception is a pulmonary veins. Then the capillaries is responsible for transport of the nutrients and the gases. Then it helps to join the veins, and capillaries helps to join the veins and the arteries. Then the blood, it is the most essential component of the heart. Then the bloods includes the plasma, WBC, RBC, and the platelets. The plasma, it is a yellowish liquid. 55% of the plasma is present onto the human's body. Then the plasma contains the nutrients, gases, hormones. It provides the body. Then the red blood cells are produced by the bone marrow. Then the lifespan of the red blood cells is 120 days. Then the lifespan of the red blood cells is at 120 days. Then the WBC is responsible in the WBC helps WBC protects the body against the infections. They produce the antibodies against the antigens. Then the different types of the WBCs are present onto the human bodies like agranulocytes and the granulocytes. Then the it includes the eosinophils, basophils, neutrophils, monocytes, lymphocytes, etc. Then the platelets. Platelets plays an important role into the blood clotting. They are essential component of the human's body. Then the system of the then the three types of the circulations into the human's body: systemic circulations, coronary circulations, and the pulmonary circulation. Systemic circulation is a type of the circulations. In these the exchange of the bloods in between the human's body parts or to the hearts. Then the pulmonary circulation, it is a type of the circulation in which the exchange of the bloods between the heart and the lungs. And the coronary circulation, it is a circulation which is responsible for transporting the nutrients and the gases or the oxygens throughout the body. Then the disease of the cardiovascular systems or the circulatory system. It is first one, it is a hypertension, stroke, then the heart diseases, blood pressures, atherosclerosis, etc. Then the diagnosis of the cardiovascular diseases, physical examinations, medical history, then the imaging studies like X-ray, CT scan, angiography, then the ECG, then the Doppler technique. Different techniques are used to diagnose the cardiovascular diseases. Then the treatment, antihypertensive drugs are used, and then surgery is used like the bypass surgery, etc. Mm, then the blood pressure, it is a force exerted by the blood through the walls of the arteries and the veins. Then the arteries and the veins. Then the factors affecting the blood pressure like renal factors, chemicals, diet, unhealthy lifestyles, etc. Thank you.